मेरा नाम डॉक्टर जोशिता है। मैं फोर्टिस हॉस्पिटल मेडिकल सर्विसेज टीम से डिप्टी मैनेजर हूँ। आज हमारे साथ डॉक्टर सोनल कुमता मैम आए हैं। थैंक यू सो मच मैम फॉर कमिंग। डॉक्टर सोनल कुमता मैम हमारे यहाँ पे सीनियर कंसल्टेंट एंड फुल टाइमर है OBGY डिपार्टमेंट में, एंड शी हैज बीन हियर फॉर लास्ट 20 years. So welcome ma'am here. Today, as this generation, there are a lot many lifestyle changes and hormonal changes. So we have seen a lot of PCOS cases. So I would like you to just tell our viewers what is PCOS.
Okay, so absolutely true, Joshita. I myself, seeing my practice evolve over the last two decades, I'm seeing lot more polycystic ovarian patients these days. Young girls, with so many issues, irregular periods, some of them coming with pimples or acne, excessive hair, without any reason, sudden gain in weight. So we are seeing, plus a lot of hormonal changes, mood swings, cases of anxiety, depression. I don't know if all of them are related, but we see a lot of hormonal imbalances. And whether you want to call it PCOD, whether you want to call it PCOS, it really is a spectrum that involves all of these problems. So polycystic ovarian disease or polycystic ovarian syndrome is one and the same. I've had some patients who called and said, I want an appointment because I have PCOD. Some of them say I have peacock. So it's scary that they know there is a problem, but they're really clueless about what that problem is.
Right. So ma'am, as we talk about PCOS, so what is the, is there any lot of irregular menstruation that happens in these patients?
Irregular menstruation by far will be the most important symptom, but that could be getting periods too early. Some of them may be getting periods late. That could be 40-45 days, 3 months, 6 months. I have patients who are getting periods once a year also. So irregularity can be varied. Sometimes they have excessive menstrual flow, sometimes they have very scanty menstrual flow, sometimes absolutely just a little bit of spotting. So irregular periods will make the bulk of the complaint for polycystic ovarian problems, but that doesn't mean if one has absolutely normal periods, then they don't have hormonal issues.
So ma'am, as we are talking about the PCOS, so are these patients mostly obese?
Yes, again, a lot of patients do have obesity, but there can be thin PCOS also. So it doesn't mean that your weight is not more, so you cannot have polycystic ovarian problems. Usually a high body mass index, and the second most important thing would be central obesity. Central obesity का मतलब क्या है कि the fats are accumulated on your center of your body, so on the trunk. So it won't be so much of limb obesity as much as, and the waist hip ratio. These are the two most important things, but we can have thin PCOS also.
So basically mostly we have irregular menstrual cycles and obese patients as a majority of the cases.
As majority.
Right. So ma'am, is there this condition, does it have a cure or doesn't have a cure?
Very lovely question, and if I have to give a very short answer to this, let me compare it with diabetes. There are so many patients who have diabetes and they take medications, injections and so forth. They are able to keep their sugars under control. Can we say they are cured of the diabetes? Unfortunately not. So similarly with polycystic ovarian problems, once you have a PCOS, then you will always have it. But that doesn't mean it's the end of the road at all. By following a good lifestyle, by exercising, by following a very good diet, keeping your weight under control, your hormone imbalances under control, you can absolutely overcome or be on top of the polycystic ovarian problems, but unfortunately it will not go away completely.
Understood. So ma'am, PCOS, when patient comes with PCOS, is there any difficulty in conceiving for them?
So let's understand the basic of what is happening in polycystic ovarian problems. As we all know, in a normal woman who is menstruating regularly, she develops one egg in that cycle, and that egg either gets fertilized, which gives rise to pregnancy, or it doesn't get fertilized, which gives rise to her periods. Now in polycystic ovarian disease patients, what happens is the formation of egg is, not happening. Either the eggs are not developing, or the eggs could develop but not reach an optimum size or reach the dominant follicle, so to say, or they may develop well but not burst. In all of these situations, because the egg is not released out of the ovary, so ovulation is an issue. Now, ovulation is definitely very important for pregnancy. But after having said that, I don't want to scare all the people who are listening to us that they cannot get pregnant. That is not the case. Yes, they can make their cycles regular. They can ovulate on their own also. And sometimes by using simple medications, we can ensure that they ovulate well and definitely get pregnant also.
Great. So, ma'am, talking about the same thing, so how is the diagnosis of a PCOS done? Does they really need to have multiple cysts to get diagnosed, or whether or not?
So, the diagnosis of polycystic ovarian problems has three main, issues. One is the clinical symptom. What is she presenting with? The second is the ultrasound picture, where we are doing a transvaginal sonography of the ovaries and seeing that the ovaries are swollen up and seeing multiple cysts. Hence, it gets his name, polycystic. So, but what are these cysts? These cysts are nothing but unbroken eggs, which have accumulated on the ovaries, causing the ovary to look swollen. And the third most important thing is the biochemical part, which is your hormones. So, you have clinical symptoms, you have an ultrasound picture, and you have the biochemistry. And at least two of these or all three of these have to be present for someone to diagnose you as polycystic ovarian problems.
So, does all these patients need a treatment, or what is the treatment plan for these patients?
Wonderful. So, the treatment really can be grouped into lifestyle modification, which will become a major chunk of treatment for most of the patients. Of course, we have medical treatments, which I would like to divide into two groups. Since I am an obstetrician, I deliver patients. So, the women who want to get pregnant, we can give a certain type of medicines, and those women who do not wish pregnancy currently, we can give another type of medications to regularize their cycle. And the third type of treatment can be surgical, which of course we are going to leave it, really at the last end. So, all these will help treat such patients.
So, ma'am, as we are talking about diabetes, we talked earlier. So, is PCOS related to diabetes?
Lovely. So, yes, as we know, polycystic ovarian problem is a hormonal issue. Even with diabetes, there is a insulin resistance issue, and these two can definitely be connected. I would go a step ahead and also include thyroid for that matter. So, very often patients with polycystic ovarian problem in future life or may develop insulin resistance and develop sugar issues, and they may also have thyroid problems. So, all of them will go hand in hand, and the beauty is the lifestyle modification or the treatment for all these will also go hand in hand. So, if you start following a good lifestyle, you'll hopefully, cure yourself of all of these.
So, basically what I understand is taking care of lifestyle, weight loss leads to a better life and solves the PCOS
most
problem.
of your problems.
Most of
right.
And what are the other treatment modalities, like any medication ways?
So, hormonal medications will help regularize the periods. When we want to help her conceive, we give fertility enhancing medications, and the surgery that I talked about is actually trying to reduce the volume of the ovaries. So, by using a specialized machine called as a monopolar cautery, we just touch the ovary at different spots. So, do these all eggs, the fluid in them drains off, the ovary shrink in size, and the woman starts getting regular periods.
So, thank you so much, ma'am. Such an insight here. So, any messages that you would like to give to our viewers?
Again, I would like to reiterate and emphasize that since this is a lifestyle disorder, lifestyle modification should be the main goal. And if I were to very simply put it, just think of the lifestyle that your grandmother's generation had. Add in the technology, to it,
Yeah.
and try to follow the same, and
Great.
you will be on top of most of the problems.
Thank you so much. Thank you so
Yeah.
much. So I would request my viewers, in case they have any queries, please put it in the comments. We'll try to answer maximum of them. Thank you so much.